the doctors are in and you have an appointment because this is Medical Monday and we're taking your questions. We're covering several medical issues today, including one that could break up a marriage. Oh, I think someone's in trouble for that one. Someone's in trouble for that one. By the way, when a spouse snores, which one should have to leave? The snoring one or the one who is being kept awake? Which one should leave? The snoring one. Yeah, that's not the way it works all the time. See, honey, I told you. Anyway, we'll show you a procedure that can help both of you stay in the same bed and get a good night's sleep. Plus, we're getting your beach body ready without crazy exercise diets or invasive surgery. We'll show you where to go in case of an emergency. You don't have to wait forever to be seen. And is a knee replacement in your future? We'll tell you about a procedure with less downtime. If you have any general health questions, just send us an email to greatdayhouston@khou.com. One of our medical professionals will try to answer your questions throughout the show today. With that being said, let's introduce our first guest this morning. Are your teeth not looking so pearly white anymore? As time goes on, they start showing signs of wear and tear, but there are things you can do to slow down or correct the problem. Here to show us how, please welcome the Texas Tooth Lady, otherwise known as Dr. Terri Alani. Hi. You are in your kind of drill sergeant wear today because one of the things that you really feel important is to educate people about something a lot of us take for granted until we have a problem.
Exactly. That's why I'm here. And what I want to talk about today is how teeth change with age. You know, we expect a lot of our teeth. We chew, we grind, we clench, everything. And for all practical purposes, they do a great job for us, but they also are affected by age.
Yeah, well, speaking of age, the thing is we are living much longer today than I think our teeth intended for us to live, right? It's like in 1900, the average age was 40. Okay, not so many problems. But today, we got to take better care of something.
Exactly, and I'll tell you, before I went to dental school, this is true, I thought that everyone lost their teeth after 50.
Oh.
I did, until I went to dental school. I had no clue.
Yeah.
And one of the big things how teeth are affected by age is through acid erosion. And the biggest culprits, of course, are your sugary and starchy foods. What happens is with carbohydrates, they ferment the bacteria, which releases acid, which can actually cause tiny pits in your teeth and cause decay.
Okay, so are there things that we can do to kind of prevent that? For a lot of us, too late, but for our children to try and prevent that, really? Because sugary foods, we're going to have them at some point.
Exactly. First thing is go easy on sugary foods. And they found now that sports drinks are actually the worst. And actually, the carbonation in sugar drinks increases the acid in your mouth. And that can cause issues, too.
Does it help to rinse your mouth after or brush right after?
It does, but actually just eliminate the carbonated sugar drinks.
Okay.
Avoid frequent snacking. If you want to crave something sweet, I like sugarless gum. Trident has some really good flavors now. I think they should come up with a chocolate, actually.
Oh, yeah.
I really think so. But sugarless gum actually helps stimulate the saliva, and it also neutralizes the acids.
Yeah, and of course, see your dentist, because there are things that you can correct.
Exactly. Brush your teeth, see your dentist twice a day, and see your dentist.
Twice a day.
I wish. That would be great. Brush your teeth twice a day and then see your dentist every 6 months because we can check things.
Yeah. All right, wear and tear. I mean, that can come from a number of reasons. Some people have TMJ, some people grind their teeth. There's all kinds of things that can cause that wear and tear.
Well, mechanical wear. Now, what people used to think is that, oh, our teeth get more brittle with age, but they don't. What happens is that if you've had like a root canal that's going to be more suspect, that's going to be more susceptible.
Well, you compromise the teeth.
Exactly. Or if you have a large filling, that's how you can actually get your teeth as far as to break. The other thing is you have to be careful. How many times have you gone to the movies and you've actually bit down on a popcorn kernel instead of the popcorn?
Sometimes people seek them out, right? You're like, oh, this is good.
And be careful when you go to restaurants because some restaurants take out the pits and the olives and others don't.
Yeah.
And we see lots of patients that have broken, fractured teeth because they hit the wrong way. Exactly.
And chewing ice.
Chewing ice. Another thing is some people clench and grind, and a lot of stress and anxiety causes that.
Okay.
So what will happen with that is over time you can actually wear your teeth down and more susceptible to decay. Now the solutions for the wear and tear would be, of course, avoid chewing ice and any other hard foods such as olive pits, popcorn kernels. Check the pits in the olives. See your dentist regularly, and also see us because we can actually spot the areas, if you have a large filling or something that we can see,
Right.
a fracture that's getting ready to crack, we can actually take care of that for you.
And if you're grinding your teeth, you can wear a guard.
A night guard, exactly.
Okay.
Yes.
The next one, I think this is the one that, you know, it's funny, when we have critical problems, we kind of put that off, but if it's something that's an aesthetic issue, we are rushing in.
Exactly.
Like
Yeah.
stained teeth or discolored teeth, we want to fix that.
Right, and of course there's lots of things that stain your teeth. Red wine, coffee, cigarette smoking. I actually tell people drink through a straw if you can. You don't want to be at a bar drinking red wine through a straw, but you know, I drink coffee through a straw, and wherever I go, if I get a diet drink, I drink through a straw.
Right.
Another thing is people don't realize that, but if you have plaque on your teeth, they're going to stain easier.
Yeah.
So the solutions are avoid foods that stain the teeth.
Well, it's interesting you make that point, because remember I just remember when I was little, I would go to the dentist and they'd make us chew on those little red tablets, and it would show you where all the plaque was, and you just, it grabs onto there.
You'd be surprised how the stain is. And you can also, another solution is whitening, either the in-office whitening or the home trays.
Yeah, and it tells you how big of a deal it is when you see like the 5,000 toothpaste you can choose from. Do those toothpaste, are they really effective, the whitening toothpaste?
Some of them, not so much. They can actually kind of help prevent stain, but they're not really going to whiten your teeth like you will have the results in the office.
Yeah,
the office,
Get the professional one. There's a reason why it's professional and overseen by a professional, because it was much more intensity in terms of it working. All right, problem gums can result in so many issues. That's why it's so important to know what condition your gums are in, because we're talking about things that can even, you know, relate to heart disease and other problems in the body.
Yeah, the biggest threat to healthy teeth are your gums, or bad gums. And basically, you really need to see us because it's an inflammatory process. We can catch it early. A lot of times, if it's gone too far, it's hard to reverse. So you want to make sure, again, you brush and floss regularly. An antibacterial mouthwash, I like chlorhexidine. We take the dye out in our office so it doesn't stain your teeth, but that is absolutely, it works fantastic.
Yeah, so is that what we consider periodontal disease, or is it?
We're talking gum disease here, yes, that we can prevent it. And also something that people might not know, since periodontal disease is an inflammatory reaction, you can eat foods that suppress inflammation, diet rich in omega-3 fatty acids, flaxseed, fish oils, and fish are really helpful in fighting gum disease.
If your gums bleed quite easily, especially when you brush your teeth, is that a sign that there's a problem, or do some people just have their gums bleed?
No, there's usually a sign there's a problem. It's usually, healthy gums just don't bleed, end of story. So you can either have anywhere from gingivitis to severe gum disease.
All right, and of course, floss, floss, floss.
Floss. Yes, and then the last one is
dry mouth.
Dry mouth. Dry mouth. The word is xerostomia. Now, our mouth does not dry out as we age, but there are 800 medications that have side effects. 800 medications that have side effects that can cause dry mouth. And as we get older, a lot of us are taking the medication. So if you suspect that you're having dry mouth, the reason it's so critical is because what it does, it decreases the saliva flow. And saliva, it's like oil in a car. You've got to have that lubricant to get rid of, to break down the food. Right. It also neutralizes acids. So you want to make sure that you go in and see your dentist or talk to your physician if you have dry mouth, because we can correct it. There's also over-the-counter medications that can help keep the saliva flow.
Speaking of correcting issues, you have a special on something that people love, because if you have teeth that are discolored, if they're slightly crooked, if you have a couple of missing teeth, you can fix it in a snap with this thing that you do in your office called Snap-on Smile. And I just love it.
No, I love it too. In fact, I'm actually presenting a lecture next weekend in Vegas on it. But Snap-on Smile, it's a removable appliance. It can change the shape of your teeth. It can whiten your teeth, and you just take it in and out, and it fits like
right over your teeth,
and
everything's like perfect. Oh, you can
go to my website. Okay. I mean, it's incredible. We do so many of them.
Yeah. Well, from now until Friday, get $200 off the Snap-on Smile when you mention Great Day Houston. If you want to know more about it, she can show you more in her office. Go there to get your teeth cleaned, to get a checkup anyway, and then she can show it to you. To take advantage of this special, call Dr. Alani's office at 713-621-5141, 713-621-5141, or find her on the web at TexasToothLady.com. Also, Dr. Alani co-hosts a radio show with her brother, orthopedic surgeon Dr. Wayne Alani, every Tuesday at 1 p.m. on CNN 650. It's called For Your Health with Terri and Wayne, so be sure to check that out. Plus, Terri brought a few Tooth Academy t-shirts for some members of our audience as well, because you were good students. All right. Speaking of Dr. Wayne Alani, he's joining us next to tell us about a minimally invasive knee fix that can have you doing karate kicks in no time, just like this man is.